So we're gonna do a Z-Track intramuscular injection. So for this one, I've enlisted the help of my patient, Becky. I'm going to administer this medication the same as with the rest of them, with the 6 rights of medication, making sure that I am verifying the patient, the route, the dose, and the medication. Did I say that? Time and documentation. So first I'm going to check the doctor's order in the MAR, and I'm going to get my medication set up and ready to go. With this one, we're going to be using a diluent and a medication. I'm going to wash my hands really good and use an alcohol swab to clean off the tops of the vials. So you want to make sure that you're using the right diluent and obviously the right medication. Different medications can require different dilutants, so it's important to make sure that you're using the right one. It's also important to make sure that you are doing your dose calculations and strength calculations correctly. So for this one, I'm gonna have a 500 milligram per milliliter strength, which requires 5.6 milliliters of my diluent. So I'm gonna go ahead and clean off the top of my vials really good. My diluent bottle has been opened, so I'm going to check it, make sure that it's still intact. The date and the time that it was opened, as well as the initials of the nurse that opened it, are listed on the label. It is good for 30 days after it's opened. So I'm going to pop the top off of that. Oops. Clean this off really good. Okay, so I'm gonna go ahead and open my needle, get everything set up. Okay, so for this part, I'm going to go ahead and uncrop the needle safely, beveled edge up, and inserting at an angle. I'm going to draw the air out of the medication vial. So like I said, I needed 5.6 milliliters. So I'm going to go ahead and draw that up out of the medication vial. And then I'm going to go ahead and insert that air into this diluent bottle. I'm going to withdraw my 5.6 milliliters of diluent that I need to use. And inject it into the medication vial. Oops. Okay, I'm going to recap my needle. Ooh. Safely, of course. And then I'm going to go ahead and roll, don't shake, your vial to make sure that you're getting it good and mixed. Dissolved in there really good. That looks good to me. And then I'm going to go ahead and uncap the needle from the syringe that I'm going to be using to administer the medication, and use the needle from my mixing to draw up the medication. So this calls for 1.5. Doctor's order is 1.5 milliliters. So I'll go ahead and drop my medication, making sure I don't have any air in there. Okay, now I'm going to go ahead and recap my needle. Okay, so I then can take this needle off and put the needle on that I'm going to be using to administer and discard these initials. So I'm going to verify with my patient that she is who I think she is. Can you tell me your name and date of birth, please?
Barbara Jones, 2/15/54.
Thank you, Barbara. Glad we're meeting.
It says it right here too.
Yes, thank you. I definitely need to check that. You're beyond, as well as compared to the doctor's order in the OR. So this is going to be an intramuscular injection. So we're going to actually use your thigh right here. So in order to find where I'm going to be inserting your medication, I'm going to use your femoral. I'm going to use the lateral femoral. Sorry, lateral femoral condyle and the greater trochanter, so that I can locate right about here where we're going to be injecting. Okay.
Okay.
All right. I'm going to go ahead and get my hands washed, and this is the best administered if they're sitting like this or if they can be laying on their side. So after I wash my hands, I'm going to go ahead and clean your injection site really, really good. Ooh. Okay. So what I would do on a person is with my hand, I'm going to lift, displace the tissue a little bit, and then I'm going to go ahead and inject my medication in a 90-degree angle. After I'm done injecting, well, I would aspirate, stabilizing the needle with my hand, aspirate, and then inject. However, if I do end up with blood return, I'll need to start over. So given that we don't have any blood return, I would inject and then immediately let the tissue come back to its normal position. And then I would go ahead and dab if there's any bleeding. And yeah, I guess I can inject an orange. So with an orange, I would make sure that I would displace the tissue. Have my gloves on, same thing, wash hands, wash site. Okay, moving this skin back and then back and then inserting at a 90-degree angle. Inject your medication. And pull out, and then immediately let the tissue fall back into place. From there, you will need to document the site that you administered the medication and patient tolerance. Make sure that they don't have any questions about the procedure, and make sure that they know what kind of side effects to look for if they need to notify me about anything. And I think that's about it.